I want to thank you all for joining us for our Community Response Fund panel discussion. You all have been instrumental in supporting our efforts over the last year, and my colleagues and I really want to bring you up to date on not only what's happening with the pandemic, but the impact of your generosity. You know, the Community Response Fund was started last March as a way to raise funds immediately to offset some of the very urgent and unexpected costs associated with the pandemic. 560 donors have raised more than $1.4 million since that time. And that support has really been instrumental. Money went to support a variety of things. So in addition to our certified PPE and homemade masks, your generous donations provided thousands of meals and hundreds of box snacks for our healthcare workers who were working very long and very tiring hours. You all also helped us collect 6,665 units of blood for our blood donor center and through our blood mobiles, and 396 units of plasma. These are life-saving materials that we needed through this pandemic, and we're incredibly grateful. Your support allowed us to provide counseling for our staff and hotel accommodations under very stressful times and times when staff members couldn't go home to their families because of fear of exposure, especially if they had a loved one who was compromised. So all of this effort, all of what you did has made a tremendous difference for our staff and our teams on the front lines. During our conversation tonight, you're going to hear from some really dedicated colleagues who have led the teams through the pandemic and can really tell you firsthand all that has happened and the impact of what you've done for us. Jennifer Harrington is our Luminis Health and Arundel Medical Center Chief Operating Officer. Kevin Crowley is our Vice President of Orthopedics and the leader of our Luminis Health and Arundel Medical Center's Vaccination Incident Command. At.Jean Murray is our System Director of Infection and Prevention Epidemiology, and At.Lenny Nyangwara is our Director of Pulmonary and Neurodiagnostic Services. So these are the folks who really led this process throughout the last year, and I want to thank them for taking time out of their schedule after they've already worked a long day to be with us tonight. So Jen, I'm going to start with you in light of your pivotal role in leading our COVID-19 Incident Command for more than a year now. Could you share with us at a broad level how the pandemic has really altered how we deliver care?
Sure, thank you, Jan. And I just want to say that starting off that I'm really grateful to be able to speak on the panel here tonight. So I would say as much as people really focused every day on the numbers associated with the pandemic, I really want to portray to the team that what we really think about every minute of every day is not really about those numbers, but really about people. And so I want to talk about that not only in regards to our patients and family members, but also our staff as well as they've managed through this pandemic. So to start with patients and families for whom we've cared for, they're our neighbors, they're our friends, they're our loved ones, and our teams have really continuously committed to ensure every one of them is cared for as an important person and not a statistic. But with that said, we can't deny that the media really has focused on the numbers a great deal. So you hear terms like positivity rates, hospitalizations, lives lost, first and second doses of vaccines. All of that is part of our daily conversation. And certainly as the Chief Operating Officer, I live in those numbers every day. But I want to highlight what I would say is an important number, particularly at this time. And almost a year ago to the day was our first. So that patient number one, our first patient we saw that was diagnosed with COVID-19 was in our hospital on March 1st. And we actually started our incident command on February 27th of 2020 and have been running that incident command with the teams engaged ever since then. And really since that moment, the pandemic has taken so many lives and caused so much disruption to our families and our communities. And I want to say we believe that it's really important to commemorate and honor all that this last year has meant for everyone. And so we're hoping you can join us for a special moment of silence on March 25th. And the team will share more information about that as this discussion rolls on. So the pandemic really triggered the fastest and most wide-reaching response to a global health emergency that we've seen in human history. And it certainly altered the ways in which we delivered healthcare and really had an impact on our staff. So we've had to meet the demands of maintaining what we would say is dual systems of care. So how we're treating both patients that were diagnosed with COVID-19 and those patients that we would typically see here at Arundel Medical Center all at the same time. So new protocols had to be established. So how we protect employees and patients, including the use of personal protective equipment and environmental changes to our spaces. Visitation was impacted, so it required us to use really creative mechanisms in order to engage and communicate with our families. We've had to use different spaces, different types of spaces. For an example, using the state supplied annexes that we have now placed on our site in order to manage the volumes that we dealt with. And staff often took on new roles to assist in what we had to develop new unique care delivery models for these types of patients. And all of this was going on while simultaneously we began an open heart program. We renewed our Joint Commission stroke certification, and we opened the J. Kent McNew Family Medical Center to service the behavioral health needs in our community. So acts of generosity we saw almost every day and sometimes every minute. They were both large and small, and they really helped equip our teams with the tools that they needed to stay safe and care for our patients. And the outreach from the community was overwhelming and really heartwarming. And I want to provide just a couple of examples. So as a result of the funds donated to support the COVID efforts through the Community Response Fund, our patient advocacy team and our patient experience team launched the Family Coordination Program. And this created a lifeline of connection. So innovatively used technology to allow families to interact virtually on video calls so that they could talk, they could pray, they could laugh, they could listen to music together as our patients recovered. And then I'll share a simple one. I think Jan already hit on this, and that was the donation of food. And sort of food gets to everyone's heart, but particularly those that were working to care for our patients put in tremendous, tireless hours and sometimes found it really difficult to get off of the unit. And so the ability to take a quick break and enjoy a delicious meal was definitely positive for them. And although our COVID volumes thankfully are decreasing, hospital capacity is increasing. In addition, we're going to play and are playing a significant role in administering the vaccine that Kevin will speak to a bit later. And I would say one of the most positive aspects of this pandemic has really been the either enhancement or the establishment of new community relationships as we've coordinated delivery of care and the delivery of vaccines to our communities, and those will stick with us past this time. So I just want to end by just going back to, that focus on people and really focusing on the staff. And I will tell you just the dedication, the resiliency, the teamwork, the sacrifice that staff have made on a day-to-day basis for now over a year is just amazing. And I can't imagine working with another team that would be better and would not be more poised to meet this challenging time. And I believe that you would be very proud, not only of the high quality, compassionate care that's been delivered by your local hospital, but also from the role that you've had in making that care possible. So thank you.
Thanks, Jen. Your leadership has really been and continues to be incredible through all this, and we're really grateful. One of the interesting things about the pandemic is it's created a lot of new roles. We're running almost a second type of care from what we normally used to do day to day. And the best example of that is one of my colleagues, Kevin Crowley. In normal times, Kevin serves as our Vice President of Orthopedics, but this year has been anything but normal. And this year he has stepped up to do an additional leadership role throughout the year, and that is as our incident commander in charge of community vaccination. Kevin, this is obviously an important topic right now. Can you describe our community vaccination efforts to date and help us understand the opportunities and the challenges as we work to vaccinate the entire community?
Yeah, thanks, Jan. I really do. First of all, I want to thank you for giving me the opportunity to kind of speak tonight. And I'm also been fortunate to be part of the incident command structure from the very beginning. And as you stated, as being the incident commander for our community vaccine response. It's both an honor and I'm proud to be part of the team to kind of do the work that we're doing in supporting our community. So even before I start talking about our community vaccination efforts, I wanted to start by talking about how closely I worked with the foundation on the gathering and distribution of the critical medical supplies and PPE during our first wave about a year ago. It was essential for our staff and for our patients to have some of the supply that we were unable to kind of procure through our normal supply chains. And I wanted to make sure I thanked everybody on this call because they were able to step up and help us get some of this supply and donate the supply to our staff and our patients. As we kind of start talking about our community vaccination program, everyone is well aware in early December, the FDA approved both Pfizer and Moderna, which was really the kickoff of the vaccination program for the country. That was the start of our vaccination program for our workforce, which was kind of led by Jen and Dr. Clance. And we were very quickly able to kind of vaccinate 60 to 70% of our workforce and to protect them and to protect our patients. As we transitioned into January and we were able to kind of vaccinate most of our workforce, we were able to kind of transition into our community plan. At the same time, the governor transitioned into kind of opening the cohorts and allowing transitioning to those who were in cohort 1B, which is those who are 75 plus. We were able to very quickly operationalize a community clinic in our Belcher Pavilion and start to very quickly vaccinate our community, which was essential. It's been a challenge. We are fortunate enough to have a great team. We were able to kind of leverage many different people from throughout the organization to kind of stand up the incident command structure and operationalize it. It's been a challenge. Things change. The state threw us curveballs every day, but we were able to kind of work through it and continue to kind of drive. And our goal was to really vaccinate as many of our community members as possible. We realized no different than what we're seeing from around the country, the demand far exceeds the supply. Our community registration form has over 140,000 people on it, and we know that can be extremely frustrated. People are eager and anxious to kind of get the supply, and we're working very diligently to kind of schedule and vaccinate as many people in the community as quickly as we can with the limited supply that we do have. The supply has been the limiting factor, and we're hopeful in the next several weeks that the supply will continue to increase, especially with the news that just this week with the approval by the FDA of the Johnson & Johnson vaccine. We actually received our first doses on Tuesday, and we'll be distributing those out to our patients on Friday. So we are excited and we're hopeful, and that'll continue to increase our ability to kind of meet the needs of our patients in our community. Our goal is to kind of vaccinate as many people as quickly and efficiently and safely as possible, using the kind of state guidelines. As I said earlier, really the limiting factor really has been our vaccine supply. We have the infrastructure and the staff prepared to do what we need to do. And as that supply continues to increase, we'll be able to support our communities with additional opportunities to receive the vaccination. Our operational plan is we release as many appointments each week as basically that correlates with the supply that we receive. Our supply has been very limited. And so over the last several weeks, we've had very few opportunities to kind of release new appointments, but we do anticipate as this vaccine supply increases over the next several weeks, we'll be able to offer more and more appointments to our community. It's important to note that we are right now focusing on the cohort, still focusing on cohort 1B within Anne Arundel County, and which is really related to those who are 75 and older. It's also important to note that we're really focusing on those patients from Anne Arundel County, and I know that may be frustrating to those who live on the Eastern Shore, but we've been asked by the state to focus on Anne Arundel County, and Shore Health has been asked to focus on those patients and community on the Eastern Shore. We know that it's a challenge for many people to kind of oftentimes get to our facility, or often even have the tools and the access and the technology to kind of register. So we have continued to kind of operationalize a call center that we can use to kind of reach our most vulnerable patients, and for those who don't have access to the community. For those who do have the appropriate technology, they're able to kind of go to our website and register and get to our pre-registration form, and we will add you to our pre-registration list and certainly invite you to an invitation to our community clinics based on the state cohorts and our ability to kind of provide that vaccine when we have enough supply. It's certainly been a challenging year, and we're as Jen stated, we're already 1 year into this, and we're hopeful as the vaccine supply continues to increase that we'll be able to reach and vaccinate more of our community. We really understand that this is frustrating, and a lot of people are anxious and eager to receive the vaccine, and we are anxious and eager to kind of supply it. We'll continue to work with our state partners to kind of supply as much opportunities for the vaccine as we can, and we're certainly confident that the light is shining at the end of the tunnel, and we'll be through this in the next several months. Thank you, Jan.
Thanks, Kevin. I really appreciate all you've done. We're sort of building this car a little bit as we're driving it, and it's a lot, but we're committed to taking care of our community. As Kevin mentioned, there is a vaccine interest form, and we'll share that with you at the end of our discussion. And we are now receiving the Johnson & Johnson vaccine in our community clinics. So Jean, you've been on the front line throughout this pandemic, and as our system director of infection prevention and epidemiology, what can you tell us about this new vaccine and why it's so important for our community to get vaccinated?
Sure, Jan, thank you. And again, thank you for inviting me tonight. And thank you again for your generosity. You were really there when we needed you most. So the emergency use authorization was recently granted for the Johnson & Johnson vaccine, which gives us now 3 COVID vaccines to use in this country. The Johnson & Johnson vaccine obviously is a much needed tool in our immunization toolbox. It comes with some benefits. It's easier to store and administer than the other 2 vaccines. And this will benefit us in more easily vaccinating the most vulnerable in our population. And it will vastly accelerate our immunization efforts. And as I'm sure Kevin can likely attest to, it should streamline the logistics of a complicated mass vaccination campaign. Also, after the spectacular and relatively straightforward 90+% effectiveness of the Pfizer and Moderna vaccines, the Johnson & Johnson results are a little bit more nuanced. I think what's important to note is the Johnson & Johnson vaccine was tested during a more complicated phase of the pandemic when more variants had emerged. The Johnson & Johnson vaccine prevents 85% of the severe disease, and it was over 100% effective in preventing hospitalization and deaths. And that's what's really important here. Overall, as part of the trial, they did see 7 deaths, but those were in the placebo group. It is effective at preventing severe illness, including in areas of the world where the most concerning variants are circulating. There was also preliminary evidence that the vaccine may protect against asymptomatic infections, which has been the key question about the vaccines throughout this pandemic. We need to immunize our country and our world as quickly as possible to end this pandemic and to prevent the emergence of new variants in the future. And these would be even more concerning ones over time. People should take whatever vaccine they can get the soonest, because all have robust effectiveness and have similar expected immune responses. You can expect pain at the injection site, fever, chills that may last a day or 2 after vaccination. Again, every one of these vaccines is your best clinical defense in this pandemic. it will take some time to vaccinate everyone against COVID. So we must keep adhering to the tried and tested measures that keep each and all of us safe. This means maintaining social distance, wearing face masks, practicing hand hygiene and respiratory etiquette, and avoiding crowded indoor spaces. These simple yet effective measures will save lives and reduce suffering that so many people haven't encountered in 2020. The combination of the vaccines, the robust testing, and following our 3 W's of wearing our mask, washing our hands, and watching our distance are what are going to help us curb this pandemic. We're seeing good news happening as well now that hospitalizations and deaths are on the decline, and we need to keep this moving forward.
Thanks, Jean. I really appreciate it. Your expertise during this time has been invaluable. Finally, I want to bring another voice from the front lines. Lenny, his team has been incredible, and they most recently were recognized for their hard work by the American Association for Respiratory Care for the Apex Recognition Award for demonstrating continued best practices in respiratory care. So really quite an accomplishment and a real tribute to you and your team and all your hard work. You've been a really important voice in taking us into the walls of the hospital to show us what our frontline healthcare workers have faced this past year. Can you please share your perspective as well as how the Community Response Fund donations have impacted your staff?
Hey, Jan, thank you so much. I really echo everybody to thank you for giving us the opportunity this evening to be able to speak to our donors, our community. So thanks again for recognizing the respiratory care department and the recognition they received from the American Association for Respiratory Care. The Apex Award places our hospital in the top tier. To put this in perspective, there are only 13 hospitals in the country that receive this award. And there are over 5,000 hospitals in the country. So here we are really demonstrating that we are providing the best care using best practice and promoting patient safety at the highest level. So I appreciate you acknowledging that. And as Jen stated, this places us about 1 year from the time we had patient number 1. At that time, when I look back, we faced many challenges. And this included the uncertainty of PPE. These days it's simple to say PPE and everybody understands what that means. And when you think before we had COVID, PPE wasn't really a household word. And then we had concerns of having enough ventilators. And that too, can you imagine these days we talk about ventilators as a thing and nobody has to really explain what that is. We also had concern, are we gonna have enough personnel to care for the patients? But it all came together. Everybody stepped up. When I looked around our hospital and looked at the departments that supported one another in order to achieve the patient care that we needed to to do. Every single department stepped up and seamlessly did their part. You can think about materials management. They were managing every single piece of equipment, every single piece of supply that was coming into the hospital. Our biomedical engineering department, and I remember biomedical engineering department running around making sure that every single one of our life support machines were ready to care for patients as they came in. When I think about our environmental department, environmental services department, this place was squeaky clean. It allowed us to come to work and feel safe. I think back at that time, and I remember several of our team members who decided to stay at local hotels for fear that they may go home and take the virus to their families. One thing they were missing at that time was the contact with their family. They could not be able to hug their children, kiss them. But their fear also showed us how much dedicated they were to our patients. They came in every single day. It was amazing to look around and see how well this worked. But the community was there for us. You, our donors, answered the call. When I look back, I see so many things that work really well. We had a place to sleep, a place to rest. Thanks to all the generous donations for housing at the local hotels. We had something to eat. We had something to drink. Thanks to the local restaurants and catering places that opened their kitchens to make sure that we had food to eat. We had PPE. You can imagine all those people who turned their kitchens, their bedrooms, their living rooms into sewing rooms, just to make sure that we had what we needed to protect ourselves. And I think back, we even had parades. Thanks to our local police, EMS, and fire. That was really just nice to go out for 1 second and wave at the parade. We even had free oil changes so that our cars could keep running and we keep on coming to work. I always say, but wait, there's more. The experience we've attained in the past year has led to better understanding of this COVID disease. As a result, we are seeing better treatments for our patients. We are seeing less severe disease, fewer deaths. If you walk around our hospital now, have masks on, but if you look into their eyes, you'll see the smiles they have. And that's really a sign of hope and a dawn of a bright new future. It takes a village. You, our donors, are the village. And the little we can say is thank you. That is the least we can say, thank you. Many people say thank you. Some people say gracias. But let me tell you what I'll say. I'll say asante sana. And that is in Swahili. And when I say to you asante sana, that is the least that I can say. I appreciate you. We appreciate you. Thank you for caring for those who care for others.
Thank you, Lenny. That was really beautiful. And I think what you're saying is really the best way to wrap it up. I think we are hopeful. As Kevin said, there's light at the end of the tunnel. So I'd like to ask each of you to share one thing that makes you hopeful as we move into March. Kevin?
I'm hopeful that spring is right around the corner and we won't have any more weather or delays that will prevent us from having the important vaccine clinics and delay the shipment of our supplies. But most importantly, I'm hopeful that we'll continue to receive the supply to vaccinate our communities and allow this pandemic to be ended.
That's great. Jen?
So I'm really hopeful that the positive trends that we're seeing in regards to volumes continue to decline. And with that, we return to normal operations. And that really means then we'll have our volunteers back on campus. So our volunteers are unsung heroes. Their role is so vital to our ability to really fulfill our mission. They're extremely missed. And I know our patients and our staff are going to be really grateful when they're able to return. I'm looking forward to that.
I agree. Jean, how about you?
What I'm telling folks is summer is coming with all the good news with the vaccines and as Jen had mentioned, the declining numbers. The reality is that the warmer weather is going to help us curb the spread for many reasons. And a good one is that we're going to be spending more time outdoors. And that summer reminds us that there is better days ahead.
Better days ahead for sure. And I want to thank Jen and Kevin and Lenny and Jean so much for their leadership, your strength, your resilience during this very difficult year, and for your time with us tonight, because I know y'all have worked long days already. I'm also thankful to all of you watching this Zoom update. Your support has meant so much to us. Not only the generous donations of financial support that allowed us to buy, equipment and PPE and all those other things, but blood donations and handmade masks and all the things that show you're on our team and that we're in this together, and the sense of community that we have here as your community hospital has never been stronger than it has been the last year, and that's thanks to you. I do want to wrap it up with a few important resources that we discussed. If you want to find out more on vaccines, our vaccination clinic, or how to fill out the vaccination interest form, please visit vaccine.luminishealth.org. If you'd like to join our moment of silence on March 25th to commemorate this past year and all that has happened and the lives that have been impacted, please follow us on social media, whether that's Facebook or Twitter, or all of our other social media outlets that'll have information on our moment of silence. Thank you all so much for your partnership, for your kindness, and for showing us that you're in our corner throughout all of this, because we hope you know we're in yours as well. We truly can't do what we do without you, and we're grateful for this amazing community. Be well and stay safe. Good night.